Good afternoon. My name is Jody and I'm the Preventive Care Coordinator with McKenzie Health System. I'm going to talk today about some problems that we've had in the past with our physician offices. We currently work with 6 different physician offices, and the problem is that each of the offices do their own thing when it comes to doing any scheduling or their referrals, appointment times, and the medical records. They all tend to do their own thing. They're not on the same page. So when a problem arises, we're not able to address it properly because there's not a certain protocol stating that they have to do it a certain way. This causes problems when there's issues. For example, medical records are not getting updated properly, and this is causing some gaps in care for our patients. When we go to the physician offices to address this with their MAs or their MAAs, there's nothing to back us on because there's not an actual policy to state that they need to do it a certain way. So in order to solve this problem, it is important for us to come up with a solution. The solution that we have is to make a policy that will be used across the board. All 6 offices will be on board with this policy. They will implement it and use it to schedule their patients, to do their referrals, and to update the medical records of our patients. This will provide us with a backing that if there is any issues that arise, that we will be able to look back at this policy and state to them that there is a policy and it is important for them to follow it, that it is across the board, and that each office needs to be doing the same thing. There's so many issues with registering a patient, with confirming their appointments. When they walk in the door, it's very important to get all their correct information. And I will touch on that and how to go about creating a better policy for our offices to use so that they are on board. Our current process involves that they set up their own appointments, they do their own referrals, but they're not following up. They're not updating patient information. They're not doing what is required of them to make sure that the job is properly completed. And this is, I'm going to touch on appointments. When a patient calls to make an appointment, it's very important to confirm their phone number. Not to ask them, not to tell them what it is and have them say, yes, this is it, but to have them confirm with us what their phone number is. Because it's very important for us to be able to reach a patient if there is a need or if there's a cancellation or for any reason. It's also important for us to ask them if we're able to leave a brief or detailed message. With HIPAA, there's so many violations that can be conformed that it's very, very important to know if we're allowed to leave a message at all. Whether it just be that they have an appointment, if there's a reminder, they need to contact us. So when a patient calls to make an appointment, the first step would be to get their name. See if they're in our system. If they're not in our system, it's important to create a profile for them, a chart, to put in their name, their address, their birthday, their phone number, their social security number, their employer, and an emergency contact. When doing an emergency contact, one area that is lacking is that there is a spot for HIPAA. Just because a patient has an emergency contact does not mean that we are allowed to give out any medical information about that. We are just able to call and let them know that there is an issue, that there's a medical emergency, but we're not able to elaborate on what that medical emergency is. So this button a spot is very important to be checked, because if a patient wants us to be able to discuss their medical information with their emergency contact, we have to have that HIPAA spot checked. We also want their insurance information. This is another area that's gray. A lot of people don't put in the insurance information. And this is lacking because this means we have to wait until the patient actually comes into the office to get their insurance information. Whereas if we have it ahead of time, we're able to verify their benefits. We know what tests they can have done. We know if they're eligible for their preventive visit for the year, if they've had their mammogram, or if they've had their colonoscopy, what they're eligible for. And this helps us provide better care for our patients by making these recommendations based on what their insurance actually is. It is also important to update their pharmacy information. It's not really a must when it comes to first initially putting it in, but it is important to have, because we do electronic pharmacy prescriptions, and so it's important for the doctor to know where to send their prescription to. So this is touching base pretty much on the appointments. When the patient actually comes in for the appointment, it's good to confirm all of this information again with them to make sure that it's up to date, it's correct. We also request that we have their driver's license and their insurance cards on file so that we can update this information and give it and have it on file so that we know what we're looking for. We also need to have them sign an authorization for treatment once a year. It's very important to have this so that they're authorizing us to treat them. And then we lead to the medical records of our patients. To update their information, we want to make sure that we have any other doctors that they've seen that is pertinent to their medical information, whether it be they've had a colonoscopy. We want to know what doctor did that, the results, because we have to have them sign a medical release giving us that information. So it's important to know what they've had done so that we can have them sign that medical release. It's also important for us to know when it was done, the month, the year, because this way we know that that measure has been completed, that they're not eligible for, another colonoscopy for another 10 years after the one that they've had. It's also important for MAMs that they be done yearly, but not too soon or not too late. Cervical cancer screenings. Any of that information is very important for us to update in our systems, because a lot of the times the insurance companies don't show that. They only show what that patient is eligible for. So we might think that they're eligible for it, but they've had it completed at another physician office. So we're not able to have the best medical information for that patient. So it's very important for us to follow up on our patients' medical records when they've seen other physicians and when they've had certain procedures or tests done. It's very, very important for all the information to be correct. And the last is the referrals. We lack in this area tremendously. The doctor will send out a referral for a colonoscopy, or they'll send out a referral for a MAM. When the referrals are sent out, sometimes the patient makes the appointment, sometimes the MAA will make the appointment. But what's happening is that these referrals are being sent out, but none of them are being followed up upon. So the policy that we're creating would include a step-by-step referral program. When a physician requests a referral, the MAA will check into the referral, they'll confirm with the insurance company what the coverage is, they'll see if there's any prior authorizations that are needed for the referral. If there is, they will They will call the insurance company and get those prior authorizations. They will then, with the patient in front of them, call the receiving referral doctor and get an appointment time. This appointment time will be added into the referral information. It will be documented on their chart, and the patient will be given the information for when their appointment is. Once the appointment has come and gone, about a week after, the MA will follow up on that referral. She will make sure that the referral has been completed, that the patient has gone to their doctor's appointment, and she will see if any medical records have been sent back from that referral appointment.